So please welcome to the stage Essence Senior Lifestyle Editor Victoria Owumarogi, Board Certified Physician Dr. Courtney Arianne Washington, and International Doctor and Public Health Educator Dr. Eric Griggs. Make some noise.
Hello, hello, hello. How's everybody doing out there? Well, good morning, Essence family. As you heard, my name is Victoria Owumarogi, and I am the Senior Lifestyle Editor for Essence Magazine, and I'm so excited and honored to be here to dive into this much-needed conversation about the new era of diet and weight loss with Dr. Courtney Washington and Dr. Eric Griggs. Everybody give it up for them real fast. All right, so let's get started. Dr. Washington, let's start with you. So we're here to talk about the importance of protecting our bodies as Black women. As a primary care physician here in New Orleans, I'm sure you see firsthand some of the issues our community faces when it comes to obesity and the resulting complications. Can you talk a bit about your experience with this and why you think it impacts our community even more than others?
Yes, so being from New Orleans, I see three groups of women that struggle with their weight. Either they've had a problem with their weight when they were younger in their relationship with food, maybe it was for comfort. The second group is those who gain weight from a stressful life event or pregnancy, and then also as we age. So when it comes to that, it's deeper than just the outward appearance, is how it makes you feel, and also the comorbid conditions that come along with that, like the risk for diabetes or development of that, or hypertension. And so not only is it just like a physical issue, it's a medical issue as well. So a lot of people are hesitant to talk about it. They're scared of medications and they go and use Dr. Google. But the impact is so great because this is your life, this is your livelihood. It affects pregnancy, leading to preeclampsia and different things like that. So I just try to make women feel welcome, explain the science, the need for medication and healthy lifestyle changes, and make them understand it more than just saying, oh, just try this drug. No, we're gonna explain it, we're gonna talk about it so you know your health conditions and how to get better.
Nice. Dr. Griggs, you're both here locally in New Orleans, and around the country, you've become known for your motto, get checked, get fit, get moving. All right. Can you take a moment to break down why it's so important for our communities to do all three of these things?
Yeah, so the important thing, first of all, thank you. This is amazing. It's important when I say get checked. It's more than just going to the doctor. It's climbing our family trees. We do the same thing every year. Every time it happens, there's a funeral. We say, hey, we're gonna get together and we're gonna talk, and it never happens. We don't talk about health enough in our family. So get checked is climbing your family tree. And there'll be amazing things that you'll find. This time last year, I found my father. Holy smokes. Yeah, and we started talking about health histories. I know that I need to be checked for certain things now because they're genetic. Going to the doctor once a year is something that we don't think about. Now, we'll plan a trip like
That's true.
this,
Amen.
but we won't plan that doctor visit. My advice before you go plan your trips, plan your doctor visit, your annual wellness visit. If you're a sports fanatic, plan your team. When your team is getting ready for the season, you go get checked up for the season, because if you like the Saints, they'll give you heart trouble. The other thing is it's having conversations about food. So I'm really, really privileged and honored to be on this panel. We've vilified food, we've vilified our bodies, and we're too beautiful of a people to be even doing any of it. We make amazing foods, we make amazing, beautiful people. So understanding what to eat, how to eat, and what works best for your body, and then get with your family and eat together. And the last part is get moving. Get checked, get fit, get moving. Now that's something that we do really well. Just find something you like to do and do it. I have no rhythm. I can't dance, but you can't tell me that I can't dance. I'm moving. Mind your business. Mind your business. So these are important conversations to have.
Nice. I love that. So there are weight loss companies that we've all grown up, knowing and being familiar with, like the Jenny Craig's and Weight Watchers, and they're suffering significant losses because people are just not making use of weight loss programs like they used to anymore. So now they're looking for quicker fixes like the weight loss prescription drugs. Can you both explain to us some of the risks that are associated with using these drugs, some of their benefits, and as popular as these drugs are, what would you say that people need to know about them before considering use? Let's start with you, Dr. Washington.
So I use semaglutide or Ozempic in my practice, as well as Mounjaro. They are great drugs. They work very, very well, but it's important to always work up secondary causes of obesity. So being a physician allows me to really do, like Dr. Griggs mentioned, do that workup, get that family history, and talk about why you are obese. The quick fix doesn't mean that it's going to be a long-term fix. So I believe that the reason that Jenny Craig is suffering financial losses is because patients are now seeing that you can go and see your doctor, get a thorough workup, and especially in my practice, we talk about lifestyle changes, how to read a nutrition label. You think you're eating something organic, right? But you don't understand how to read that nutrition label and that it's processed, pushing more fresh foods and things like that. And it's not gonna be always just a quick fix, right? Because we don't wanna gain the weight back. The medication is gonna make you lose weight regardless, but you can't sustain it if you're not eating well. So that's usually my big practice. But the side effects of the medication, if you're not getting it from a licensed physician, from a certified compounding pharmacy, and if you're getting it from out of the country, you don't know what's in that drug. So I work in the ER as well, and what I see is people go over to Mexico and they'll come in with big bruises, their liver enzymes are elevated, and I cannot tell you what was in that drug. So that's a huge side effect that I see from the drugs that are used off-label, or you're taking the wrong dose. I've experienced people that have taken their other family members' Ozempic at the highest dose. You're gonna cause liver failure. The positives about the drug, if you're going to an actual physician and they're working you up, is that nutritional counseling is gonna take away the hunger sensation in your brain. It's gonna help your body use and process the foods that you eat more efficiently and target your body to use more of the fat cells for energy so you're able to lose weight. But I cannot stress big enough, these internet, get Ozempic for $200. Guys, even the compounded medication is more than $200. Do not budget shop on your body. This is your body. You only get one.
Amen. Dr. Griggs, what would you say?
Yeah, so the big thing that I'll add to that is the good thing about these drugs is the conversation is taking place that obesity it's a disease. It's a chronic disease. Like, it's just like any other condition, there are medications that can help. Now, that moves into the mental because we vilified ourselves. It took me a long 53 years to get this beautiful and fine, so it's gonna take me at least 5 to 10 years to get it to where it needs to be again, right? There's no such thing as a quick fix. But what you can change quickly is your body image. There's no pill, there's no shot, there's no magic wand you can wave to all of a sudden look like you think. It's gonna take work. So all of these drugs, and I do emphasize, they're drugs. The reason that you're paying more is because you get a whole doctor with it and a whole workup that you should get, because everything that you take affects every part of your body. And it's irresponsible to get these without healthcare supervision, because this might not be the one for you and it might not be the dose for you. But the important thing is to look in the mirror and understand these things are only going to help me be as beautiful as I know that I am. I can change my diet, I can exercise, I can laugh with friends, and setting long-term goals. I'm going to lose your body safely. You can lose about 1 to 1.8 pounds a week safely without your body. If you've ever been on a diet before and it failed and ended up bigger than you were, more fine than you were before, it's because your body wasn't keeping up with what you were trying to do with it. Working with your body, being patient, giving yourself grace, and knowing that you're beautiful every day will help you, along with the doctor, use these drugs properly.
I love that. I love that. And Dr. Washington, in your opinion, what's the first course of action that someone should take if they know they have a significant amount of weight to lose and they don't want to go to the weight loss drug route? How do they start the path to get healthier or possibly to save their own life?
Starts with finding a good primary care physician.
Say it again.
You need to cover your basics, your annual exam. If you go and you buy a Range Rover, right? You're gonna go get the Range Rover's oil check when that light comes on, and you're gonna spend the amount of money and take it to the dealer. Your annual exam is very important. Family history, as Dr. Griggs says, is important because I'm gonna be screening you for certain things, maybe younger, and find that out. So that's where you need to start first, because I'm gonna work up secondary causes of obesity or whatever's going on. So that's where you start. Second is going over, like he said, other things, your self-image. Depression can also lead to weight gain. If you're depressed, some people go get that big jar of Bluebell ice cream and they just gouge on it. So
I
let's
feel
address
seen.
the depression.
I feel very seen right now. I feel
Ain't nothing wrong with no
attacked.
Bluebell ice
No
cream now.
judgment.
Come on,
Attacked
come on.
right now.
No judgment, but it's true. It's true, and they do that. So sometimes you don't need an Ozempic. What you need is a diagnosis of depression. And every time I say depression, like, oh no. Like as Black people, we need to talk about it. It is okay. Statistics show a good 80% of people will be clinically depressed at least one time in their life. There are medications that are safe that can treat that depression, and now you're not overeating. So
Right.
that's where we start. And also exercise, people, not just walking. If you walk, oh, I walk a lot for my job. No, that's not exercise. Exercise is saying, you know what? I'm making this time for myself. So you're giving yourself a mental break. You're preparing your body for that. And you are doing exercises that are gonna be good for your cardiovascular health and your overall well-being. It's for your brain and your body. So that's where you start before we even talk about weight loss drugs per se.
I love that. You got to take care of the mind first, and don't go ham on the Bluebell, y'all. Share it. Sharing is caring. Okay.
Hey.
Sharing is caring.
We're not talking about just you, Dr. Griggs. Look,
Right, well,
if I
we know
see
what
you
you're
in the
doing,
Whole
Dr.
Foods,
Griggs. We
at
know you eating the
ice
Bluebell.
cream,
I feel so attacked.
I'm gonna be your accountability partner. Put that down.
But no, Dr. Griggs, you created your foundation, the Doc Griggs Foundation, around the idea of promoting community health and wellness. So what are some of the initiatives that you've taken on to build awareness among our community about the importance of safe weight loss?
Wow, so it's conversations going from church, to school to anyone that will listen, letting them know, first of all, that food is your friend. There's no such thing as bad food, there's just bad portions. And I educate. We've done bike rides, we've done the Bayou Classic events, the numerous walks, we've done the, the scavenger hunts all over the city, trying to make it fun. If you trick people into being healthy, you make a lot of friends, but you gotta trick them. Like even over today, I have hula hoops, and I challenge anyone to a hula hoop contest. Did you know that you burn 7 calories per minute that you hula hoop? 7 calories per minute. So in 10 minutes you'll burn about a bag of chips, 70 calories. So getting people to understand that you can't outwork or exercise a bad diet. You can take all the Ozempic, you can take the Wegovy, you can take any of these quote-unquote miracle things. If you're eating a bad diet, you're not gonna lose weight. It begins with food, nutrient-rich, calorie-poor foods. And my example is, has anyone ever ate a whole head of cabbage? A whole pot? No.
I'll bust.
It's not gonna make for a good day or good night if you do. I wouldn't advise it, but that's a whole lot of food. So nutrient-rich, calorie-poor foods, I won't say calorie-poor, but calorie-less dense foods, and coloring up your plate. Showing those examples, starting with the babies, and taking it all the way up, because kids will change a household.
Yeah, very true, very true. And lastly, we know that much of the issues around obesity that we deal with in our community, it comes from generations before us that just didn't know any better and passed those issues down in regards to diet and how we eat. So for the men and women in the audience raising children of their own, how can we begin to make the changes that are necessary to turn this health crisis around and positively impact our children and generations after them? Well, I'll let Dr. Washington go first.
So that is a great question, because always when I talk about a weight loss program for the mom, I always ask, okay, is husband on board? Right? Because you need an accountability partner. It makes no sense for you to start the diet, but you still got the chips and the candy and the sodas and no fresh produce in your house. Okay? And when they're like, oh, my kids, they like this food. No. You buy the food and you program what they do like. If they see you doing it, they're gonna wanna do it. So it has to be a family effort. Childhood obesity and these problems, there are studies that show that when kids, they asked, when does cardiovascular disease start, right? So they all looked at the pediatric patients, and they saw that with poor diets, they start to develop coronary artery plaques by age 5 years old. So even though they may not be obese today, you're setting them up for heart disease later. So feeding them all of the processed frozen foods, all of those things, are going to individually land them up in a poor health spot. So I try to encourage, because I'm a mom, I have twins, I work, I do a lot of things. My slow cooker is my friend. You press the button, you got red beans, you come home, ooh, somebody been cooking all day, right? So those things are relatively inexpensive. So making time for yourself, again, we're busy, but you have to make time for your body. You only get one. And especially for your kids and your whole household. I've seen whole families change and look completely different and feel completely different, especially when we talk about little Black girls, right? As they grow older, they notice and they pick on them when they're overweight, right? Imagine how they feel when they're able to eat healthier, they're able to participate in physical education longer than mental and building up the self-esteem. So it's really, really a big issue, but it's a family effort.
Dr. Griggs?
So high-functioning societies are child-centered, adult-governed, and elderly-ruled. Now, if you take that society to a family model, the family that cooks together and plays together lives a real long time. Cooking together, teaching your kids healthy habits, challenging your kids, pizza night, who can make sometimes you'll get jelly beans and licorice and crazy stuff on the pizza, but you got to, if you make it, you got to eat it. Right. But challenging and making it fun, letting everyone look for healthy recipes to cook and having a taste contest with a prize at the end. I keep bringing up hula hoops. If you want to incorporate your grandparents, you would be surprised. I challenge anyone in here to talk to their mom, challenge their mom or grandmother to a hula hoop contest. Kids don't hula hoop. We didn't hula hoop, but they did. I'm telling you, they started wrapping around their arms. Jumping the whole nine, but it's all about the smiles and the fun and the talking and the feeling included. You get it at both ends of the spectrum. Your seniors as elders that govern the family, they feel included. The kids, they love it because they get to play with mom and grandmother. Prime example is my grandmother started us mall walking when I was 11 years old, and all the way through med school, it ended up being my mom, my grandmother, my grandfather, my uncle, my aunt, my sister, my 3 cousins, whatever dude they were dating at the time. We started mall walking, and ironically, we come from 5 generations of diabetics. None of us are diabetic.
Wow.
Amen.
And she changed our food too. She had us eating off sausages instead of a plate, and my grandfather wasn't having it. He was upset. Yeah, he still wanted a big piece of chicken and a big plate, but it's working and it's working. Doing those things, just loving on each other and keep making it fun, starting in the kitchen and going outside and playing, you'd be surprised. Just don't let your mom be the banker, because mom, yeah.
From Ireland, they only like vegetables. When I started having them cook with me, he's like, "Oh, these green beans are the best I ever tasted." Yeah, they are.
Because they cooked it.
Exactly.
Ain't that something?
I love that. So you guys hear that? You got to cook with your kids to help them to learn some of these healthy habits. We got to work on our mental health so that we can have better habits when we eat, so we're not indulging and doing the most with our Bluebell ice cream, even though we love Bluebell. We love Bluebell.
Come on now.
You don't have to bring it back to that. And you got to just, go and see your doctor. Make sure you're making these appointments. They made some really great points, and I hope that you guys gathered a lot from that. So let's clap it up for Dr. Courtney Washington and Dr. Eric Griggs.
Thank you.
Helping us kick off Essence Fest right.
Thank you.
Thank you both so much for joining us today and dropping knowledge. It was an honor to have you. So thank you.
Thank you.
And thank you guys for sitting and being here for the first panel. We've got more coming, so thank you so much.